Hi, my name is Dr. Megan Anderson, but you can call me Dr. Meg or just Meg. See, I am a doctor of physical therapy with over 11 years of experience as a physical therapist, primarily with a background working in a level one trauma center as well as a physical rehabilitation center. But today, I am a long COVID rehab specialist. And if you're wondering what the gap is, how I got from there to here, well, I went from being a staff physical therapist to a frontline healthcare worker in the early days of the pandemic when I was working in the hospital setting. And early on, I could see the writing on the wall that there was something different about this, and people were having post COVID complications and not getting better as everyone anticipated. And this really led me to opening my own private practice that is an entire virtual COVID recovery program using the skill set and the knowledge that I have to help people. Fatigue is a one-to-one proportional response to the activity or the stimulus, um, where it matches up in the response that your body has. Okay. Whereas post exertional malaise, PEM or PEM, is an exaggerated and out of proportion response from your body compared to the activity or stimulus. And that activity or stimulus doesn't have to be physical, it can be social, it could be emotional, it could be cognitive or a thinking task. It could also be environmental, things that are like chemicals or irritants or sounds or vision and sight. And so it could be all these different things that trigger an out of proportion response, right? It's not normal for you to get up, go fill your water bottle, walk around the house, do a couple of chores, and then be wiped out for days. That is post exertional malaise, an out of proportion response of your body to the stimulus. Now, the other thing is it's not just fatigue, and it can come on. The thing that's different about it is that there can be post exertional symptom exacerbation, which is where you have a change in symptoms like brain fog, chest tightness, racing heart, stomach upset, numbness, tingling, burning, all these different sensations. Then there's also post exertional neuroimmune exhaustion, which is where it almost looks like you caught a cold, right? You have fever, chills, body aches, and even swollen lymph nodes, and you feel like you're sick. And the difference is that there's a delayed onset. It doesn't happen right away, and it doesn't get better with rest, where normal fatigue does. Yes, there absolutely are treatments for PEM. You don't have to just live with it. If you're asking, are there medication treatments? Um, the answer is it depends. That's a very gray area, mainly because there are so many different reasons that PEM can be triggered. However, the best and the number one treatment is pacing, right? So, how can you avoid triggering the post exertional malaise in the first place? So, a lot of this comes back to manage identifying and mitigating, or so identifying and minimizing triggers um, that cause post exertional malaise, and then pacing and modifying your lifestyle once you do understand what those triggers are. There's many different ways to pace, and I think the most simplest way, if you're unfamiliar with pacing, is the stop rest pace approach. So the way that you apply the stop rest pace situation is that anything that you're doing, like I said, anything, whether it's physical, social, cognitive, emotional, environmental, anything that you're doing, if your symptoms are starting to increase, then take an awareness of, okay, um, are they significantly increasing? Because the thing is, when we do something, that's any form of effort, that's exertion, and the key is not to never exert, the key is not to over exert. And so what I would say is don't allow your symptoms or your exertion to go 2 points higher than where you started. Okay, so if you're doing if your headache, your stomach upset, and your dizziness is like a 2 out of 10, don't let it go over a 4 out of 10. Okay, so it's okay to have a little bit of an increase, but when you've hit that threshold where you're like, oh, this is a significant increase, you should stop what you're doing. Okay. Rest. And when I say rest, rest doesn't mean do nothing. Think of it as something restorative. Okay. And I can talk about what something restorative is. So, rest, allow your symptoms to come back down, back to, where they were before you were applying effort. And then you can try that activity or whatever it is again, but pace. So, meaning use some type of a modification. So, whether you do it a little bit slower, you break it up into smaller chunks and you do it in pieces, or you do it in a different position, or you modify it by using some type of aid or asking for help. You do something that changes to make it easier on your body. In regards to the overall question of how do I know when to increase the intensity of my exercise, if you've been doing a consistent level of whatever exercise it is you choose, what I would say is that you need to do it at least 3 days within a 7-day period without experiencing any significant increase in symptoms or post exertional malaise before you can even consider moving on and increasing it. So you need to at least have multiple exposures to that thing for at least a week before moving on. And what I would argue is, in this case, more is less, and your body craves predictability, it craves consistency, and staying at one level for longer than you think, I think, is far better than increasing too soon and not being ready for it. But when it is time, you say, okay, I've been doing this consistently for multiple weeks and 3 times every single week, and I haven't had a significant increase in my symptoms, and I'm not experiencing post exertional malaise from it. I'm going to increase. What I would suggest is that whatever it is that you're doing, only increase by 10 to 20%. So if you're doing 10 repetitions of something, add 1 rep, add 2 reps. If you're doing for time, say 3 minutes of something, right? Add 30 seconds. Super low, okay? Because it should be so low that it's not a huge stress on the system and you can easily pull it back if it's too much. So that's what I would suggest in terms of gauging things as a basic framework. Again, it's individual from person to person, but basic framework.
This is part of a series of videos I'll be sharing, where experts answer your questions about ME/CFS and Long COVID. It's been created in partnership with Turnto, a free app which is basically a ginormous database of information about ME/CFS and Long COVID. It covers the most recent research, treatment reviews, and has experts sharing their words of wisdom. If you want to watch an extended version of this interview, find out what other experts are coming up, and submit questions to them, then download the Turnto app. I've put a link in the description so you can go and check it out now.